Hi, good morning, everyone. My name is Dr. Sarah Tan from the SGH Department of Endocrinology, and I'm very happy to be here with you today to talk about the importance of weight management in the treatment and prevention of cardiovascular disease. Okay, so we know that obesity rates in Singapore have been steadily rising over the past 10 years, with 10.5% of our population being obese. And the recent COVID-19 pandemic definitely didn't help matters, with nearly a third of Singaporeans actually gaining weight during the pandemic. Okay, so some basics. How exactly do we define overweight and obesity? So to do so, we will need to calculate our body mass index using this formula here, which basically tells us whether our weight is appropriate for our height. And in Asians, looking at the table on the right, overweight is defined as a BMI of 23 to 27.4, while obesity is defined as a BMI of 27.5 and above. And what's the problem with obesity? So it's associated with many complications, including things like diabetes, heart disease, mechanical problems like joint problems, mood issues like depression, cancers, and overall a reduced life expectancy. So focusing specifically on obesity and heart disease, how exactly does obesity lead to heart problems? There are actually several mechanisms behind this. So firstly, obesity directly damages the heart by increasing the risk of blocked arteries and dilated heart. And it's also associated with other risk factors of cardiovascular disease, such as high cholesterol, diabetes, high blood pressure, and sleep apnea. And this damage leads to an increased risk of heart failure, heart attacks, and abnormal heart rhythms. Okay, this all sounds very scary, but not to be afraid, because there's actually something that we can do about it. And the good news is that weight loss helps to reduce the risk of cardiovascular disease and may be able to reverse some of the damage. Okay, so you may be wondering, how much weight do I need to lose in order to protect my heart? Do I actually need to hit my ideal body weight or reach a normal BMI of below 23? The good news is that that is not necessary. And while greater weight loss is associated with greater medical benefits, studies have shown that generally a weight loss of about 10 to 15% is enough to reduce the risk of cardiovascular disease associated with obesity. Okay, so now that we have a goal weight in mind, how should we go about losing weight? And unfortunately, this is the difficult part. As we all know, losing weight is not so simple. And even if we are able to lose weight, maintaining the weight can be even more difficult. And many of us may think, or we may hear people or the media telling us that losing weight is as simple as just calories in and calories out. And we may think, okay, all I need to do is eat less and exercise more. Unfortunately, our bodies are not as simple as a calculator where we can just add and subtract the calories in and calories out to calculate how much weight we can lose. And this is because when we make efforts to lose weight, there are actually complex hormonal changes and metabolic changes that occur to defend our weight, such as a reduction in metabolism or a rise in hunger hormones. So for anyone here who has struggled to lose weight or struggled to maintain your weight after losing weight, please know that this is not a willpower issue or a compliance issue, and you are not a failure. This is physiological and it's due to our natural body response to weight loss. Okay, so at this point, some of us may be feeling very discouraged, wondering how on earth to go about losing weight if it's so difficult. So let me reassure you that we are here to help. This pyramid here gives an overview of our treatment strategies in tackling obesity. So looking at the bottom of the pyramid, we can see that diet and physical activity form the foundation of the pyramid. Basically, there's no running away from this. However, diet and exercise alone may not provide enough weight loss for people who need to actually lose more weight. And then we move up to the second level, which is pharmacotherapy or weight loss medications, which can help to provide even more weight loss. But of course, medications also have side effects, and thus we would only use them in patients who really need it. And at the very tip of the pyramid will be for patients who have a very, very high starting weight and need more drastic measures to help with weight loss. And here we have procedures and bariatric surgeries that can help patients to lose even more weight. Okay, so like I said, diet and exercise applies to everyone. So let's start off with some simple things that we can incorporate in our daily lives. And this applies to everyone, whether we are trying to lose weight or whether we're just trying to maintain a healthy weight. So in our meals, we can adopt a My Healthy Plate approach where we fill at least half our plate with lots of vegetables and fruits. Carbohydrates like rice or noodles should only take up a quarter of our plate, and we should opt for low glycemic index carbohydrates like brown rice. And the last quarter should be filled with lean meat and fish. For drinks, we should stick to plain water. Okay, so in our local context, it's also important to beware of certain food and drinks that contain hidden calories. So, for example, I have some patients who tell me they eat very little during each meal, they cut down on the rice, they don't eat any rice. However, when I actually probe a bit more, then they tell me, oh, yeah, I have some kuih after lunch, or now it's durian season and I have been having durian every night, or I like to drink bubble tea. But all these things are small things, right? So you may be shocked to know, but most of the things on this page actually contain more calories than a bowl of rice. And what's even worse is that they don't keep us full and they're not nutritious or balanced. So by actually eliminating all these sweet drinks and unhealthy snacks from our diet, it can actually help to cut way more calories. And later on, we'll also have a more detailed talk on diet and healthy diet and heart health. Okay, exercise is also a very important part of weight loss and weight maintenance. It helps to maintain our metabolic rate and muscle mass, and it also has direct benefit on conditions like diabetes and heart disease. There'll be more on this later, but of course, if you do have any underlying heart disease or serious medical conditions, please discuss with your doctor about appropriate exercise. Okay, so if you have reached a point where you have tried the above measures, but you have still not reached your goal weight, what is next? And so this is where we come in, specialists in treating obesity, because weight loss medications may actually be helpful for such people. Okay, I'm not going to go into the detail of each type of weight loss medications due to time constraints, but we do have several options available, including oral tablets and injections. And basically how these medications work is that they act on either the gut or brain or both to reduce hunger signals and increase fullness. So a few important points that I would like to emphasize. Weight loss medications need to be prescribed by a licensed doctor and only to patients who meet criteria for treatment. So this includes people with a BMI of 30 and above or a BMI of 27 and above with complications of obesity like diabetes, high blood pressure, or heart disease. It's also important to steer clear of weight loss supplements and slimming pills sold over the counter or online. These may actually contain illegal substances. They have been described to have deadly side effects like heart attacks, strokes, seizures, or liver failure. Okay, and lastly, talking about surgery. Procedures or surgery to reduce the size of the stomach can result in even greater amounts of weight loss, but they are also associated with increased risk and cost. So for these procedures, usually we would recommend them only in patients with more severe obesity. So I've come to the end of my talk, and I hope that it was useful in giving you some practical tips on weight loss. If you would like to seek an opinion about more advanced options like medications or bariatric surgery, our team at the Obesity Center would be very happy to help. Yeah, thank you.